Welcome back to another thrilling episode of the Feminine Frequency podcast. Today, I am joined by Julie Lipsett, who is a fertility awareness educator. Thank you so much for joining us, Julie.
Thank you for having me here.
Absolutely. Absolutely. I'm really excited to dive in. Would you mind sharing with us a little bit about your story and how you got to get into this work?
Sure, yeah. I think like so many of us who do this work, I got into it because I have really irregular cycles and painful periods. And the moment I can still remember this so clearly, it's just one of those moments that it's, going to change, it's going to change your life. I was reading Laura Brydon's book, The Period Repair Manual, and she has a line in there that says your periods shouldn't be painful. And no one had ever said that to me. I was in my mid-20s, and that was the first time I was ever hearing that. Our like discomfort around our cycles is just so normalized. And that moment was just like a light bulb went off for me. It was one of those moments where I was like, oh, okay, so this is something that it's not too much to ask for, to not be this uncomfortable so often, to not have to call out of work because I'm PMSing, or to not have to like just suffer through a day on ibuprofen because I have my period. And that kind of like just set this off in me where I was like, I need to know more. So I found fertility awareness from that and cycle tracking from that. And when I started taking my basal body temperature, which is how you know when you're ovulating, um, it was just so incredible to see my basal body temperature rise. I had seen this like, oh, this should happen. I'd seen sample charts or other people's charts online. And then to see that actually happen in my body was like, oh, I'm not broken. My body's doing what it should be doing. And so from there, I just needed more and more and more. I was so excited to bring my charts into my next OBGYN appointment just for it to be kind of dismissed. So at that point, I was like, you know
Oh,
what? I need to learn to teach this. I need to like, that's when I signed up for I like angry Google searched the fertility awareness educator programs at that point. Um, and I landed on the program that I ended up doing. It's through the Wells School of Body Literacy. It was such an incredible, life-changing program. And graduated from that after 2 years, and here I am.
wow. Wow.
Getting to teach this to other people. I'm getting to see other people going through this all the time as part of my career. It's really such a gift.
That's awesome. Yeah, it really is. It really is. Um, so backing up just for a moment, what exactly is a basal body temperature and how does one take that?
Sure, yeah. So basal body temperature, it's kind of like your core temperature. You take it first thing in the morning before you wake up, or well, when you wake up, before you
Mhm.
go to the bathroom, drink any water, before anything else can kind of influence your body temperature. And we take this because it'll shift throughout the course of your cycle. At the beginning of your cycle, it's going to be kind of in a lower range. And then after you ovulate and you have progesterone in your system, it'll be in a higher range. And so it's a good way to confirm that you've ovulated because, unless you're sick or the room is hot, like there's some kind of external factor influencing your body temperature, that's really the only reason that your temperature would rise. And it could be like from half of a degree to an entire degree. And then stay kind of like sustained rise for that long.
And is it just a normal thermometer or is there a different?
Yeah, there are basal body thermometers. It just can't be quick read. So it's not going to be like a fever thermometer that you would use when you're sick. It's something
Okay.
that would take maybe like, I think 30 seconds to 2 minutes. There's also wearables, like if anyone has an Aura ring that will do your basal body temperature, although it's not necessarily like proven effective if you're using the method for contraception. But then there's also something called a temp drop, like that you can wear overnight if you don't want to be waking up at the same time, or if you're breastfeeding or night shift worker or something like that. So there's other ways around it with the amazing technology we have. But
Yeah.
yeah, it's basically just kind of trying to get at that core temperature and to see how your hormones are influencing your temperature.
Okay. So it's more about the timing and doing it first thing in the morning. before
Yeah.
any other factors come in. Okay,
Right. Yeah.
cool. So how did this new knowledge that you acquired and, I would imagine empowerment through that knowledge, like how did it affect your life? What benefits have you seen from it?
Yeah, I mean, at the end of my teacher training, we had like a week out in Oregon with in person with my whole class. And I came home from that thinking like, wow, I really love my body. Like I can't imagine my life without my menstrual cycle. I know that there will come a time where that will happen. But it really just is kind of like this very grounding, guiding force in my life at this point. And it really shifts your perspective. I think it's really hard to check in with your body on that level every day and not start to build like a better relationship with it. It also has been so helpful just to kind of shift out of this mindset of like, I'm broken that I think so many of us are given because we go to the doctor and like the focus is on what's wrong, not like preventative or not what's going well. And instead you kind of just get to see like your body doing what it does because, that's just how our bodies work all the time. And we can focus on this part of our body, especially in a way that has kind of a more like loving and positive spin on it.
I love that. That's so beautiful that it really like nurtured and helped you cultivate a more loving, respectful relationship with your body, just of appreciation and
Yeah.
um, sort of affection and admiration for your own body. That's a beautiful benefit.
Yeah, it really is. And it's like, it's probably my favorite. There's so many shifts that have happened in my life since then. Um,
Mm.
I think that the other piece of the method is tracking something called cervical fluid, which is produced in your cervix, and you kind of check it on your toilet paper or in your underwear or at your vulva. And it just kind of like helps you get a little more familiar with that area of your body. And it shifts it from like, ew, that's gross to like, wow, there's this amazing, literally life sustaining and life bringing fluid that's just being produced in my body. So there's these like little mindset shifts everywhere that like, yeah, that can be a learning curve when you're starting to, you're like, what? I have to touch this fluid that's coming out of my vagina. But it's such an amazing shift for that to happen.
Yeah, to kind of get over that programmed response really of
Mhm.
disgust
Yeah.
and the you factor to actually just be like, you know what, this is my body. Like, of course, why wouldn't I touch it? Right.
Right. Right.
Getting through that barrier of the shame and
Yeah. Yeah.
revulsion about your own body that's huge. That's
Yeah.
huge.
Yeah. And what
And
you hear so much is like, oh, well, I just thought like anything coming out of there was an infection. And like it's, it's just helping like reduce anxiety around that. And you know what's going on and like what you should be seeing and what you shouldn't be seeing. And um, yeah, it really kind of shifts the narrative there.
yeah, definitely. And I think that's why, I think it's such an important part of the work I do with women too, of, just being more empowered, being more
Yeah.
in touch with our bodies. There's this long-standing stigma, right, of like disconnection from our bodies and shame around our bodies. And just to begin to become more embodied, literally
Mhm.
to see how marvelous it really is. It's
Yeah.
just,
Yeah.
it's so empowering.
It's really powerful. And I
Yeah.
think we just don't realize how disconnected we are, how much like we have anxiety or fear or, just like these really hard feelings towards our bodies until they start to change.
Mm-hmm. Yeah. I know for me, I wish I would have had access to this information so much sooner in my life.
Yeah.
Um, because it like you said, it's a whole different perspective. It's really a paradigm shift.
Yeah.
So obviously, like you educate around fertility awareness. So obviously that's important when a woman wants to become pregnant,
Mhm.
right? But are there other ways in which that can be useful, such as not becoming pregnant, for example?
Great. Yeah, totally. So it is a an effective method of contraception if you're looking for natural contraception options. I like to just let people know that you don't have to be taking hormones if that's the right path for you. That's great. But we have options around it, and there's ways to avoid pregnancy. I also tend to get a lot of people who come to me who just kind of want to know their bodies better, like they're already not on hormonal birth control, and they really just kind of like want to know what's going on with their cycle, um, and connect more with themselves. They might be really into cycle syncing, and this is kind of like a step beyond that, where you're getting not just that intuitive sense, but you're also getting the data from your body about what's going on, and you can kind of pinpoint these shifts in your body down to a couple of days. Um, it can be helpful if people aren't sure what's going on with their menstrual cycle. They might have symptoms they're worried about that they feel like their doctors might not be taking seriously. They might just not know what to ask or know if something's normal or not. And that can be like anything from, I don't know when my period's coming, and then like, you don't have to be worried that you're pregnant, if you haven't ovulated yet, like that kind of thing. It can give you this just like more confidence in navigating your cycle. It could be, I have spotting at weird times, or I have a lot of PMS and I'm not sure why. And it can give some insight when you're working with somebody who's got the training in the background to interpret your charts. It can give you some insight into what's going on with that. So, I can be like, hey, well, why don't you ask your doctor about this? It can kind of give you a direction. It can kind of help you know the language that your doctor might be using, like what they're like why they would test something when they test something. And it can help you with advocacy around that as well.
Absolutely. And with your own, back to your own story, like
Mhm.
it helped you actually alleviate or prevent or avoid the painful cramps?
Yeah, I mean, I still struggle with the painful cramps. I've done so much,
Mm.
and I'm still, trying to figure it out. And sometimes my periods are just painful. It's helped me a lot with kind of acceptance around that. It's helped me with being able to plan ahead, and so I can know like, hey, I just ovulated. I know in 2 weeks from now I'm gonna get my period, and
Yeah,
I'm gonna have
yeah.
to just plan to take some time for myself around that time. Um, it's helped a ton with the irregular cycles because
Mm.
uh not knowing when your period is going to come, like if anyone listening has ever had that experience, not only can it be a little anxiety provoking, but it can be like, oh my gosh, when is this going to happen? Like it's just kind of this like thing that should be this kind of somewhat predictable pattern that we just don't have, and it's like I could just start bleeding at any time. So it helps a lot with the predictability. Once you ovulate, your luteal phase is generally going to be a similar length from cycle to cycle, maybe like give or take a day or two. And so it helps with the predictability. It helps with not, panicking or knowing, should I take a pregnancy test now? If you're trying to conceive, it can also help you know, okay, I shouldn't take it quite yet because it's not time, or I can take it now. So it just kind of helps you like get a little more grounded into your cycle. And
Yeah.
um, I've noticed it can like reduce a lot of anxiety and a lot of fighting yourself.
Yeah, yeah, definitely. I think, just the awareness is just so helpful
Mhm.
to kind of, like you said, like plan ahead as much as
Yeah,
possible, right? And to
yeah.
know like, where am I in my cycle? Like, is it luteal? Is it,
Right.
what's the one after you menstruate? The
Follicular.
follicular,
Yeah.
right? So like, and you start to become more aware, like, how do I feel? What's going
Mhm.
on? What's my energy level?
Yeah.
And that
Yeah.
can be in itself so so good, so
Yeah.
helpful.
Yeah. And what was really helpful with the cramps was also just advocating for myself to my doctor. Like I'm immersed in this, but I just like I had the confidence to say like, hey, this isn't right. Even though it wasn't like directly coming off of my chart. I know what they're talking about when they're talking to me. They're not throwing words at me that I'm not recognizing.
Mhm.
And I kind of like just having that kind of like this community of people that I've gathered throughout this journey has been so helpful to just give me the confidence to ask for what I need. So it's been, even though the cramps haven't gone away, it's definitely pushed me in the right direction.
Yeah, yeah. Kind of put you in the driver's seat of
Yeah.
that conversation. Yeah.
Hmm. Yeah.
So as far as someone who would be trying to, prevent pregnancy
Mhm.
naturally, what, you know, I guess what are the odds, shall we say? Like, is that effective, or how effective is it? As relative to contraception, like hormonal contraception.
Yeah, so we do have a study. It's actually a pretty well done study. That study indicates that the symptothermal method, which is what I teach, that means cervical fluid and basal body temperature, um, it's in the 90s. I think it depends on, I'm forgetting um, the exact percentage. It's like mid to high 90s, which is pretty much, no contraceptive method is 100%. So it's up there. It has a much higher
Yeah.
user dependency than something like a pill or especially an IUD, because there's a little more room for error. You have to be communicating better. And sometimes I like to think of it as like kind of a contraceptive like guide too, because when you're beginning to be fertile after your period, that once you ovulate and the egg is gone, hasn't been fertilized, you can't get pregnant until your next cycle. So when you could potentially get pregnant within your cycle, and then you can make decisions on how you want to navigate that. So some people might feel really strongly like I cannot get pregnant. They might decide to
Yeah.
abstain completely from having any like penis and vagina sex during that time. They might decide to use condoms. They might decide to use condoms and withdrawal. Some people feel, you can kind of decide on your contraceptive method during that time. And then you can decide how comfortable you feel outside of that time. So many people do pair fertility awareness with some kind of other contraceptive method like condoms or withdrawal. Um, but even on its own, it's very effective if you're
Hmm.
doing it right, if you've
Yeah. If
learned
you
from
do it.
somebody, yeah, if you're doing it right, if you've learned from somebody who is trained and is making sure to follow up and make sure you really understand it, then it can be a very, very effective method.
Great. Yeah, I recently learned that a woman only ovulates one day out of her cycle, or she's
Yeah.
only able to get pregnant one day out of her cycle.
Well, so you ovulate on like ovulation, I think
Yeah.
is kind of talked about as like a phase of your cycle, but it's really just a moment in time when the egg leaves the ovary.
Oh.
And then after the egg leaves the ovary, and then in the case of like fraternal twins, there might be a second one that ovulates within 24 hours later. That egg can live for about 24 hours. So the maximum amount of time that there is an egg loose in your body and able to be fertilized is maximum of 48 hours. But really, we can get pregnant having intercourse anytime leading up to that where we have cervical fluid in our system. So that's why cervical fluid is really important, because that's actually like a sperm feast. It's going to keep the sperm alive long enough for it to meet an egg and to fertilize an egg. So you want to know when our fertile window opens, which is when we start to have cervical fluid visible that we can see. And then we want to know when that closes, once that kind of window of like 24 to 48 hours post ovulation is. So it comes down to about 6 days out of our cycle where we can
Hmm.
possibly conceive from having intercourse with someone who can get us pregnant. Um, but yeah, it's really kind of a much smaller window than people generally think of. We think of it as like you have sex, you're going to get pregnant, end of story. And that's not necessarily the case.
Yeah.
Which, I could go on forever, but that's, it's harmful for everyone. It's harmful for the people who don't want to get pregnant, who are afraid of having sex or like there's anxiety around it, that's not really helpful for us as, inherently sexual beings. It's also harmful for people who want to get pregnant because then they think, I'm not getting pregnant right away. Why isn't this happening? There must be something wrong with me, when it's just this lack of background knowledge that so many people don't have.
Yeah. Yeah, those are both great points. Absolutely. Um, so how do you generally work with people, like in person, online, in group settings, individually, some of all of that?
Yeah, a little bit of everything. I've been trying to move more in person. I don't have a physical space, so whenever there's somebody who's willing to let me use their space, I've been trying to take them up on that. To teach somebody the method, I have a class series that's generally a group. It's just, more cost effective to learn that way. And it's, about like 6 hours of class time, at least how I'm teaching it right now, for you to learn everything you need to know. So you'll learn about the menstrual cycle. You'll learn all about your fertile window and like that time you can get pregnant, how you can identify it, any variation that you might expect. You learn what to observe, how to find it, like, how to know if you have cervical fluid, the details of how to take your temperature, and then how to put that on a chart and interpret it for whatever you might need to do to use it for. And then I work with people individually following up on that just to really make sure they understand it.
Okay.
I also, if someone's already charting, I can just, we can just jump right into individual sessions. And then I also do meetups pretty regularly, once a month on Zoom, where we can just kind of talk about the menstrual cycle. I can talk and share what I've been sharing here, but I also love to hear from other people too and their experiences. Um, and that, we just kind of chat about whatever comes up, from like PMS to like helping male partners get on board with the menstrual cycle, to how we know that fertility awareness works. Just anything's fair game. So yeah, those are the main ways. I'm doing some meetups in person as well, just to like, it's so nice to see people in person after
Yeah, it really is.
but most of what I do is online right now.
Hmm. Awesome. Awesome. Well, that's great that you have a lot of options and it seems, pretty accessible. So that's really cool.
Yeah. Yeah.
Um,
My goal is to just get this to as many people as possible. So, I feel so passionate about it. So I love to be able to share it.
yeah, absolutely. So I have a question related to my own just personal interest because I have a daughter who is 11, almost 12.
Yeah.
Are you ever teaching to, girls and young women who are just starting this, exciting part of their life, menstruation, or is that not really your audience?
Right now, it's not really my audience, but I get this question so often. It's something that I'm going to have to dive into at some point because, people don't want their daughters to go through what we went through.
Exactly.
So many people don't have good experiences starting their periods and with their initiation into this part of their lives. Yeah, right now, what I tell people is like, the best thing you can do for your daughter is educate yourself and to start to shift your own narrative about your period. How much different would your experience have been if your mom was honoring her period and resting around her period rather than saying, I'm just going to take an Advil and go to work anyway? Like, how much different would your experience have been if it was talked about? It wasn't something to be ashamed of. So that's what I tell people right now is, take care of yourself too, and then you can pass that on. But yeah, it's definitely something that's on my radar.
Perhaps a follow-up podcast episode that's
Right.
more about the initiation
Yeah,
in
yeah.
girls.
It's a really powerful topic.
Yeah. But I think, just, yeah, like you said, like just really normalizing the conversation
Mhm.
and modeling the the normalization of it, the acceptance of it, and love for your own body, love for your and respect for your own cycle. That's
Yeah,
huge because
totally.
all kids, learn from what we do more than what we
Yeah.
say.
Yeah. Yeah. And like, I feel like I see that starting to shift even from when I got my period, but I'm still seeing kind of like it being modeled like, oh, it's just gonna suck. Like, take some medicine and you'll be okay. It's still not modeled as something like that's that doesn't have to be painful, that doesn't have to be uncomfortable. And of course, like your body's adjustment to menstruating when it hasn't before, that menarche can be uncomfortable. Um, but I would just love for more people to be communicating like it might suck and it doesn't have to. Like you can take care of yourself.
Yeah.
That can make it okay. And it's okay if you need to rest. It's okay if you need to take a nap. Like that's kind of what how I wish we could shift the narrative.
Yeah. And that it is, really such a blessing too, not a curse, right?
Yeah.
Even though it can be uncomfortable, it's like, just think about the amazing, you know, process that's happening that's enabling, it's to enable life, right? So it's like just having appreciation for that and for
Yeah.
how, beautiful the design is really. So,
Absolutely. And even if you're not like a person who wants to bring life ever
right.
or right now, it can just bring so much balance too. It's gonna just slow us down at times, which is it's so hard to slow down.
Yes.
And
Yes.
so it just like it can bring so much balance if you let it.
That is so very true. Yeah, I used to really just like dread my period and just think of it as such a hassle and a
Mm.
burden and now I really just I kind of look forward to it because I'm like it's an excuse to slow
Right?
down and rest and
Yeah,
I'm all go 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 all the time, but it's
yeah,
like for those
yeah,
couple of days I have to just chill.
right.
So good,
Yeah,
because I end up feeling so much more energized on the other side and
yeah,
always having some kind of like epiphany or breakthrough or
yeah,
up level in some
yeah.
way. And
Yeah, I
so
think there's something about like that like kind of fogginess that comes over you. I'm almost there right now. So I like can have a very embodied experience of it. But there's something about that fogginess that comes over you that just helps you access yourself on a different level. Like I also just had a cold and I had like so much insight that came out of this cold like because I think my like thinking brain was just down for the count. So we have this ability to access deeper levels of ourselves every month. I've had months where like I have been a mess leading up to my period, like sobbing for 2 weeks. But if I let myself like really process that, like it doesn't come back. These are things that, are bothering me my whole cycle and it's bringing it to the surface and it just gets to be processed through. And it feels
Mhm.
better on the other end. So it's amazing what happens when we feel our feelings.
It really is. It really is. Yeah, I mean, in all the goddess cultures and goddess myths, well, in a lot of them anyway, there's this story of the descent, into the underworld, like in Persephone and
Yeah,
Inanna, and they go into the underworld and then they come out and they're like they've gone through an initiation, they have this sort of rebirth, right?
yeah,
From rising from the ashes kind of experience. And I feel like the menstruation cycle is that, you
totally.
know, it's
Yeah,
a natural
yeah.
descent and rebirth every month,
Yeah,
physically,
absolutely.
emotionally. Yeah.
Yeah, on every level. And of course that's going to be uncomfortable, right? It's like when you put it like that, it's like, okay, that's nothing compared to, what this could be like going through all of that.
Yeah. If you just kind of surrender to it and allow it, it makes it
Right. Yeah.
easy.
Yeah. Yeah. I always like to recognize that it's a privilege to be able to surrender to it. But whenever like if you're lucky enough for your period to come on a weekend or something,
Yeah.
it's a great opportunity to let that happen.
Absolutely. Well, thank you for this conversation and for doing this work and raising awareness. It's just so, so important. And I'm so glad it's becoming more just widespread and a little bit more mainstream so that we can, be empowered and advocate for ourselves and just being more, touch with our bodies and our rhythms. It's
Yeah.
very, very important. So thank you.
Thank you too for this platform and for having this conversation with me.
For
I love
sure, for
any
sure.
opportunity to get to talk about this. It's yeah, it's really cool that this gets to be my career.
Yeah, definitely. I love when we can make our passion our career. It's the best.
Yeah. Yeah.
So how can people get in touch with you? What's the best way to do that?
Yeah, so I'm on Instagram, julie.lipsett.fae. I'm sure that'll be at least the spelling of my name will be in the
Yeah.
description. My website is therapywithjuliallc.com. I'm also a therapist with a full practice, unfortunately, but that's the other side of what I do. And either of those are great. I have contact button if email's more accessible. But yeah, even if someone just wants to talk, like have a similar conversation to this, I'm always up for chatting about the menstrual cycle. Can't get enough of it.
Amazing. Well, thank you so much for being such a great resource, Julie. And it was so fun to connect with
Yeah,
you.
you too.
Hope to see you soon, maybe in person. That would be awesome.
Yeah.
And thank you so much for listening, everyone. We'll see you next time on the Feminine Frequency. Bye for now.